Good evening, everyone. This is Adil Virani, and I'm here with James McCormack. Do you want to say hi, James?
Sure. Hi, everyone. And not quite evening yet for us here in BC, but pretty close.
Yeah, so we're very excited to be able to share some of this webinar information with you. I hope you'll find it an added feature to help engage with us, ask us some of the questions that you have. The first webinar is a bit of a trial webinar where we do an introduction to the course and get a sense to just work on how do we use the webinars. And over the course of the next few months, approximately every 2 weeks, we'll be having webinars to talk a bit more about the clinical content that's part of the course. In today's webinar, we're going to go through a whole bunch of different components of the website and the course, but we're really not getting into any of the clinical information. Before we get into the webinar, I wanted to make sure you guys at least had a way of interacting with us. If you look on your, hopefully it's a dashboard or on your control panel, I can't see exactly what you see, so I'm not sure exactly how it appears on your screen, but there should be a chat feature and a question feature. And I see someone here said, will we need a headset, for example? That was from OnCar. If we're doing the online versus telephone, and the answer is no, as long as you've got good speakers on your computer, or if you can hear us fine, you don't need a headset. If you'd like to have a headset, you can. Given the number of people that we anticipate will be attending the webinar, so right now I see we've got about 25 attendees, you will not be able to speak onto the webinar because it would just get too confusing if all of us are speaking. So you'll all be muted, and the way you'll ask questions is through the chat or question tab, just as OnCar did with the headset. So hopefully I answered that question. And in case none of this is working, I will send you my email address. I'll just type it into the chat feature right now, and that will be another way for you to interact with me during the session if you have questions and you can't seem to figure out how the chat session works. There is one other thing I'll orient you to, and that's a way to raise your hand. So there should be a little sign of a hand that you can see, and right now I don't see anyone's hand raised, but there's a way to say you're asking a question or raising a hand, and it's part of the control panel. And I'll just, I've cleared the hands here, but I did see someone had their hand raised momentarily and took it away as they were playing with the buttons. So if you see a hand, it kind of looks like someone putting up a stop sign. Feel free to press that, and that'll give me a clue that there's an issue on your end. So maybe I'll pause there. I'll see if there's any questions coming in, and I'll let James get over to the next slide.
Yeah, and actually it would be good if a few of you could just throw a few things into the chat to make sure that you can actually hear us. That would be awesome.
Okay, I do see another question here. This is a question from Sigal. It's, will there be notes available? So we are planning to, which is a great question, we are planning to record this session. In fact, we've already started, and the plan is to upload the recordings of our sessions on the website. So you'll be able to get a copy of the recording if you missed it, and for the many Ontario NDs or other NDs who are part of the course who didn't get this, they'll be able to see that. We will likely, James, what do you think, put up the slides?
Yeah, we'll definitely do that when we get into the therapeutic discussions. This one, I mean, I guess we could post some slides, but it's more just general information. But once we get into, talk about infectious diseases or cardiovascular disease, we'll certainly give you our slide set that we're going to go through.
Yeah, and so I hear from N. Henry and Terry Vander Hayden, hopefully I've said that right, that you guys are hearing us okay. Hopefully others are hearing us okay as well, but hopefully you can get a sense now of how you can interact with us with questions that you have. And I'll wait till James finishes some of his topics to bring back questions, and we will have some time at the end of this presentation to just address any questions that you have.
Yeah.
So that's our plan, and our hope is to get done by about 7:45, 7:50 your time. So if you're wondering about how much time you're going to spend with us today, that's our goal.
So why don't we just go ahead and get started? So what we've been asked to do is to present a number of webinars for you guys. And what we wanted to do is we thought it might be just useful to go over the introduction to the whole course in the first place. And so we're going to let you know a little bit about who we are. We'll give you an overview of the course. We'll talk about some of the objectives and expectations, and then we'll give you a quick orientation to the website, although I imagine a number of you have already had a look at it. We'll talk a little bit about the assessment process, and then we'll just see if there are any questions. So I'm the guy on the top. I'm a professor with the Faculty of Pharmaceutical Sciences, and probably for the last, almost 25 years, I've been educating physicians, pharmacists, nurses, students, pretty much everybody who will listen to us in regards to rational use of medication. And I've also been teaching naturopathic physicians for probably about 3 years, and it's been certainly from my experience one of my best educational experiences going.
And I'm Dil Varani. I've worked with James for many years. I'm the dude at the bottom. I've been involved with kind of teaching the naturopathic docs here in BC for a fair bit of time. I help run some of our lower mainland pharmacy programs and teach a therapeutics course over at the university. And you'll find actually a slide or a video that gives a lot more in-depth background to both James and myself. And so you'll want to listen to that to get some more details about us.
So just a quick disclosure, neither of us have any financial relationships with any pharmaceutical companies.
And I do work with a few different agencies that deal with, rational use of drugs. And you'll see some of those agencies on this slide: the Canadian Agency for Drugs and Technology and Health and the Patented Medicine Price Review Board. And I do work a little bit with the Therapeutics Initiative. And
I do some expert witness stuff in medical legal trials, and I also, some of you who've been following along in the course know that we do a weekly podcast, and I'll talk about that a little bit. And I also make some iPhone apps, but I don't make a lot of money on those. So I think our objectives of and expectations for the course are as follows. We want you to, ultimately, we want you to be able to create a therapeutic plan and monitor therapy to ensure safe and effective treatment. And this applies to almost any therapeutic plan. So while we're going to be focusing on sort of prescription medications, we actually mean anytime you put in place a therapeutic plan. And some of the things that we do, and one of the things that we always start off with is talking about how to critically evaluate the medical literature and promotional materials. And it's one of the things that we've felt was very, very important, in that if you know how to at least have some idea of looking at the medical literature, it really helps when you're making decisions and trying to engage patients in sort of a decision-making process. And so we actually focus a fair amount on that, and we probably will do either a webinar or a couple of webinars on that to help you guys out. We will... and what we ultimately want you to do is that you will be able to use the specific substances that the Ontario naturopathic doctors have access to. And I know that's still a little bit under discussion, but obviously we want you to be able to use those things. But we also want you to be able to take a patient, and we know they come to you on lots of medications. We want you to be able to actually help them figure out whether or not they need to be on or off those types of medications. One of the things that and we'll talk about this a little bit more as we go along, is we're huge fans of informed decision making, versus saying we're not big fans of having, as healthcare professionals, of saying, I think you should do this, 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 and this. It's more, here's what we know, here's what evidence we have, and let's have a shared decision making sort of process, and that's a thing that we really push. We're going to make sure that you guys know when prescription medications are appropriate and or desirable to use for specific conditions. So we're going to go over a whole bunch of them. We'll identify strategies for determining which prescription and over-the-counter medications are utilized for various medical conditions. So we'll put that, we'll show you how we do it, and hopefully you'll learn some interesting stuff from that. And consider a number of factors such as efficacy, safety, and cost when selecting a prescription medication. Because it's really about, does it work, is it safe, and what does it cost? And those are the main things that we're going to talk about. We'll give you some approaches on how we think medication should be started, and also how we increase the doses when we're selecting medications. We'll also talk about how to stop a medication. which I think, if anything, we do more of that than we actually start medications. We want you to identify strategies for determining when a prescription may not be needed or potentially harmful, and then, as I mentioned before, how to stop medications, and also when sort of bad outcomes are occurring with a medication. We'll talk about how you can assess that. So just very quickly, just to give you a little bit of a therapeutic philosophy, we have a common goal is to improve patients' well-being through therapeutics, and really anything we do is potentially therapeutic. So it's not just prescription medications. And I'll be honest with you, even though there may be a debate about who should or should not prescribe, interestingly enough, Adil and I don't have prescribing rights here in BC. But we don't really think it's important who prescribes, but if anybody is going to be using any sort of therapeutic recommendation, it needs to be done well. And we strongly believe in the principles of evidence-based practice. And evidence-based practice is really three things. It's the best of it, using the best available evidence, and sometimes there may be very little. Clinical experience, which is very, very valuable, and then integrating all of that with patient preferences and values. And maybe we'll spend a little bit more time talking about that as we go along as well. Now, I thought I'd just quickly throw up this particular quote because I think it's very, very useful. And we don't need to talk about, whether a certain medication is a prescription medication or alternative medication or whatever. In our minds, there cannot be really two kinds of medicines. They're not conventional and alternative medicines. In our opinion, there's only one medicine that has been adequately tested and medicine that is not. And medicine that works and medicine that may or may not work. And so we believe strongly that once a treatment is being tested rigorously, it no longer matters whether it was considered alternative at the outset. It doesn't really matter how we categorize it. It really is, does it actually work? And one of the things we'll talk about maybe a little bit is we actually don't tremendously care how it works. It'd be nice to know that, but ultimately we're just trying to figure out if it works. So this is our sort of understanding of naturopathic doctors prescribing medications. It's our understanding that you guys focus on the whole person, trying to reduce risk in preventing illness, and that you use sort of nature's healing powers to treat the cause of the illness and teach patients about appropriate health. And again, we support that 1,000%. One of the key things is we obviously, and I think this is every profession, don't want to do any harm. And you guys utilize all sorts of different treatments, whether they be nutritional supplements, botanical and homeopathic medicines, manipulative therapy, and hydrotherapy, and so on. And we just think prescription medications are just another modality for which you guys are able to think about. And even though you may not be able to prescribe a whole bunch of these at the end, I don't think that matters. One of the things that came clear from the courses that we've been putting together is that you will at least have a far, far better appreciation for how to deal with a patient in front of you who's on 5 or 6 medications or maybe 10 or 15 medications and how to think about it. So anything you want to add to that, Adil?
No, I think you're doing a great summary of our approach and things like that. I think you're doing great. And I've just done a sound check, and lots of people are responding, saying they can hear really well. Awesome, great. So a couple of disclaimers. So again, one of the things we believe is that you do have to have, to be able to use medications properly, I think you have to have considerable experience and understand the pathophysiology of a condition and the pharmacology. And we're not going to spend a lot of time on pharmacology. Pharmacology is sort of how things work, but we're going to spend more time focusing on therapeutics. And the content of the course focuses primarily on the safe and effective use of prescription medications and some Schedule 4 agents. And we'll talk a little bit about some of the schedules. We're not really all familiar with all of those as well, but we'll chat about those a little bit. And many medications are discussed in this course, even if, like I said, they're not part of your prescribing armamentarium. I think it's really important that you are familiar with how do you think about using statins or antibiotics or any sort of medications. So what I thought I would do is, why don't we just see if there's any questions, and then if there are any, that's just the background questions, and I'll just give you guys a quick orientation to the website. Okay, and that's a good point. People have been responding to the sound check really well, but no one's asked any questions yet. You don't need to wait till the end to ask any of the questions. If you have any questions, feel free to send them to us now. While James is speaking, I'll be monitoring the questions, and we'll interject with them as we need to. And if I don't see any questions, I'll either assume everything is going well on your end, or you can't hear a word we're saying. Hopefully it's not the latter. And hopefully this beginning part has been somewhat useful. I think the orientation to the website that James is about to take us to will help you get a better sense of exactly how you can use this comprehensive tool. Margaret has just asked a question. Do we need a textbook for this course?
We'll get to that.
Great question, and yes, we will get to that, Margaret. Thank you for asking that question. And we encourage as many people to ask any questions that you may have.
So all of the material for the course is on a website called the Therapeutics Education Collaboration, or therapeutics.education.org, and hopefully you can see the website that I'm showing you. This is a site where we host all of the podcasts are, and these two very charming people here are not. This is not a Dill. This is myself and Mike Allen, and he and I have been doing a weekly podcast for about probably 5 or 6 years on a whole bunch to do with evidence, how to think about medications, and with your being involved with this course, you get free access to all of the podcasts. And we'd encourage you to start listening to some of them, because I think we go over many of the different topics in ways that hopefully are informative, and you'll hear sort of the discussion about how to think about it. But typically you won't be going to this therapeutics.education.org. What you will be going to is a site that that looks something like this. And so if you haven't gone there, then we're not sure how you're going to start doing the course. But anyway, here we go. And the way you sort of navigate through this course is to click on this blue bar up at the top. And what we've done is try and put in enough information that you can sort of follow along. So why don't we just go through the place? This part right in here really just is to say we're we're glad that you guys are participating in this whole process. And so why don't I just sort of click on a few things and just show you around. So if you click on the Getting Started button, we list here all of the process for how to get started with the course. We've had a number of questions from people about, what do we do? And here's a whole bunch of information about how you take the course. The framework for the course is based on a book called Therapeutic Choices, which is an evidence-based, or fairly evidence-based anyway, therapeutics text. And you can order the book. We don't make any royalties on it, but we were able to get a cheaper price for you guys. I think it's about 15% off. I can't remember exactly what it is, but you get some sort of a bargain if you click here. And in that book, there are approximately 125 therapeutic topics, and you'll need to cover about a third of them in depth for the oral exam, and we'll talk about that in a minute, and 2/3 of the topics, which includes the previous third, in depth for the written exam. And all of those are outlined in a spreadsheet that you guys will have access to. If you click here, this will download an Excel. I won't do it now because it'll probably just screw up the website, not the website, but the image that you're seeing. And you can download an Excel spreadsheet which outlines all of the material, what you have to know, what you need to know, what information is available, and so on. And I'd encourage you to do that, and it'll really lay out the whole process for the course. And if you're just looking for just some useful evidence-based websites, you can click on this link. So the order in which we suggest you follow the sections are as follows, is to watch the section entitled Introduction to the Course, and you can link to it that way. Watch the evidence principles process. And then these are the key pieces of information that you need to sort of ground you in the course. And then, well, it's not crucial, we'd encourage you to maybe go with primary prevention, cardiovascular disease, and then prescribing principles. And one of the things we also would suggest is that much of the material that's in the different topic areas that we're talking about, there is a specific chapter in therapeutic choices that you're supposed to read. Now, there is also a pharmacology text called CAT-SUN, and that's for people who, if you just can't remember anything to do with pharmacology, you may need some useful information to help you figure out, or remember, what's a beta blocker, what's an ACE inhibitor, or, I don't even know what class of antibiotics penicillin is, and those sorts of things. So I'd encourage you to have a look at that text if you need it. We want you to watch and listen to the live recordings of this session, but it's not applicable if we did a live course, but primarily we want you to listen to the recordings of these. And then there's a whole bunch of, there's a podcast, there's letters, there's tool for practices that all surround particular topic areas. As far as how long this takes, I think there's roughly around 30 to 40 hours of material, of recorded material that you need to listen to. And once you've done that, we think you probably need another 30 to 35 hours of sort of studying to be able to do that. That's what we were told by the people who took the course in BC. And the main way to study for this course, especially for the oral exam, is for each medical condition, create a list of the top 5 therapies. So let's say we're talking about pneumonia. You would identify what are the top 5 therapies that you would use for that, and know the pros and cons of each drug class. And you should be able to figure out, how big a benefit, what the toxicities are, and the side effects and convenience and all that sort of stuff. And your job is to basically create a therapeutic plan. And we'll show you some of that as we go along. So that's the sort of getting started process. Now, if you go back to the course welcome page, you can click on here and it tells you a little bit about who we are. We've already spent time talking about the course overview and objectives, but if you click on that, you can see a lot of the stuff that we've already talked about is right there. If you go to the course content, this is where you're going to probably spend most of your time. If you click on the course content, and you'll see there's all sorts of different, and you can get there by clicking here if you want. If you just click on each one of these, you'll see these are all different topic areas. So there's psychiatric disorders, neurologic disorders. And if you look at the Excel spreadsheet that you will have downloaded, you can see which of these we actually talk about. We don't talk about all of these. But if you, for instance, were to click on Introduction to the Course, there is a video. And there is a video of about 30 minutes in length, and you can click on the play button. And for all of the videos, you'll see that there's a printable handout and then a web-based handout, and they're just in subtly different formats. And it'll also tell you at the top what readings you should be doing in therapeutic choices, and whether you need to do, if you're a little bit weak in pharmacology, what you can do for that. And you can see that there's the course basics, there's guidelines, patient values, evidence principles, and so on. And that is how you access most of the content. Most of the videos should play fairly well. For some people, depending on the computer you use, you may need to download some plugins for particular things, and I'll show you where you can look at that information. Actually, I'll get to that in just a minute. I'm going to talk a little bit about the course textbooks. So if you're interested in the course textbooks, the book that we typically use for this course is called Therapeutics Choices. The most recent version was just released, and it's the 7th edition. If you earlier bought the 6th edition, don't worry about it. That should be fine. But if you haven't bought it yet, you need to buy the 7th edition. And I would strongly encourage you to buy it, because I really don't know how you can study for this course without having that information in front of you. But these are all the links that you need to be able to get that in that book. And here's the promotion code that you can use for the book and so on. And here's another link for where you download all of the resources in the spreadsheet for the whole course. Now, the Prescribing Therapeutics exam, which I'm sure most of you are interested in, and Adele, you may want to talk a little bit about this as we go along, but the whole process works for the exam. There's 2 parts to the exam, and to register for it, you need to visit the College of Naturopaths of Ontario website once they've got that information available. To the best of my knowledge, we've been trying to set a time for the exam, but at present we have not got that, because there's still issues with the Controlled Acts regulations and so on and so forth. And so the way that the exam works is there's an oral assessment, and this is one of the key parts in how we'll actually help you study for this particular part. And this is a one-on-one oral assessment. Participants will be given probably a 1 or 2 page, usually a 1-page case, which gives some basic background about a particular patient. Or they might be hypertensive, they might have heart failure, they might have reflux or a variety of things. And your job is you'll be given 25 minutes per case to develop a prescribing plan, and that includes writing a prescription and a follow-up evaluation of the patient. You're going to be given 3 cases. where you'll develop a plan. And your job will be to go and meet with an assessor, and you will say you'll need to outline your goals of therapy. And in fact, Therapeutic Choices has all of the goals of therapy listed for almost every medical condition in it. What your 5 treatment options are, including the advantages and disadvantages of each treatment, the treatment plan, any additional aspects of the case the naturopathic doctor wants to address, and the outcome of the assessment will be pass or fail. And if you do fail that, we will provide you with specific reasons for how you failed. And there's a variety of ways that you can actually fail that exam. We've listed those there for you. One of the key things is we will, almost for sure, there will be a patient who you see will have a significant allergy to a particular medication, or at least an intolerance. And if you recommend a drug to which they have a significant allergy, that's a great way to fail the exam. Because if you do any serious harm to a patient, that automatically means you fail the oral exam. If you recommend a drug that has an important interaction, that is also something that you could fail the overall exam, because again, you've done some harm. If you recommend a dose that's way above what's really normally recommended, that's tricky. That can also lead to a failure on exam. And not necessarily a failure, but you may get a lot of marks deducted if you don't treat a potentially serious condition. So we've actually had people who would say, because of X reason, I've decided not to treat this person's pneumonia. That's not a good idea. And so we'd encourage you, if they have a serious condition, that does need some level of treatment. And also, a number of the patients that you'll see will be on medications for which it's probably causing the problem. And if you don't stop those medications, that will also be a reason to lose some marks. And so that's sort of the oral assessment. And the written exam is just a basic written exam. It's open book, multiple choice, and short answer examinations. There's around 100 multiple choice questions, and then you have to write 10 prescriptions in a proper format. You'll have about 2.5 hours to complete the exam, and again, the outcome of that will be pass or fail. We've been told by your college that you need to successfully complete both oral and written portions of the exam at each setting. So if you go in and you pass the oral but fail the written, you still have to go back and write the oral and written again the next time around. So that's the general gist of the examination process. I don't know if you want to add anything, Adil, or have there been any questions?
There have been quite a few questions, some good questions. I've been responding to them, and I hope people have seen my answers to the questions. I know many people probably have similar questions. I think you've covered the exam process really well. The exam will take about 5 hours in a day. It's not a quick exam. There's about 2.5 hours, or there is 2.5 hours for the 100 multiple choice questions, plus the 10 short answer prescription questions, and we can provide more details on that as we go forward. And some of the multiple choice questions you will see as online practice questions. There are 60 online practice questions, which we also do plan to revise. I'm not sure if they're posted right now, James, but if they're not, we do plan to post some for you. In addition, there will be some practice oral cases that you will see, but mostly these webinars are going to be great for your practice for the oral cases, because we're going to use a format similar to the oral case when we go through those. So it is our job to get you as prepared as possible for the exams. We want to give you, we're giving you lots of different ways to learn the material to suit kind of your learning styles. You'll have to do a lot of work and effort, but we will try to guide you through all the components of what you will need to know for the exam, and we'll do a lot of that as we go through each of the webinars. And you'll see, if you've watched some of the videos, we refer back to the exam and the types of questions and possible, pitfalls and things like that. So we are very focused on the result of you passing the exam and want to kind of get there. Shall I go through some of the questions at this stage, James?
Well, yeah, go ahead. I saw a couple of them. I think one of the things, I think study time is more than what I've actually stated. It really depends. Like if you have no recollection whatsoever of pharmacology, yeah, it probably will be. But if you have a fair amount of information, we're hoping it isn't more than that. It really depends on how well you can learn the material. What does take time, as you know, as you're aware, the exams are open book, so we're not asking you to memorize stuff. We're asking you to understand and come to the exam with a process for how to make an assessment of a patient of a case in front of you. So it may take you a while to develop those sort of that approach and so on, but it's different than an exam which you may be used to, where you got to memorize everything and regurgitate everything. This is certainly, the oral assessment is far less of regurgitation versus a format and a process of how to think about material. So I don't know if that really helps it, but that's the way we've seen it. We do realize this is a difficult course. This is not when we were asked to put this together, we felt that it was really important that if you're going to be getting certain prescribing rights, and I do realize they're different in BC than they are in Ontario, that you need to be competent. And it's really hard to know whether this process sets up competency, but we try our very best to make sure that you have at least the ability to pass the exam in an appropriate way.
Mm-hmm. And we've tried to design the course very similarly to what the folks in BC and Alberta have already gone through. So as people travel from across the country, as if life takes you there and you set up shop in BC and Alberta, your work done here in Ontario should qualify for licensure in those cities, at least with respect to the prescription exam. So you can feel confident knowing that you're learning some of the similar material to those of your colleagues in BC and Alberta.
Yeah.
And yeah, I think the expectation should be, so that you're not overwhelmed, that it is a fair bit of work, lots of hours, the kind of thing that you want to do slowly over time as you get towards the exam, rather than 2 weeks before the exam or less, trying to study it all then. This is not the kind of material you want to cram, because there's so many disease states, so many nuances with each disease state, so many different types of drugs that are within scope for the exam. There are some that are out of scope, things like chemotherapy and antipsychotics and a whole bunch of IV drugs that aren't particular to what will be in your scope here. So there are many drugs that we're not even including, but even with the ones that we are, it is a lot of material. So we want to make that really clear up front so that you guys are aware of that. One of the questions around the exam date, and do we have any idea when it is? We've tentatively booked January 24th and 25th. It really depends on how many people have signed up for the course by then. To run the exam is quite an expensive and complicated endeavor. We require many assessors that come to do the oral exams, and we want to make sure we have a certain minimum number of people available to write the exam. So the date of the exam is a moving target, but definitely I believe there will be exam in the first 3 months of 2015. So we will make you aware of that date once we know for sure if it's a date other than the 24th and 25th. There was a question about podcasts on the exam, and the way I had answered that was to say the material of the podcasts will be relevant to information in the exam. There will be a lot of overlap, but many people who don't listen to the podcast can still pass the exam by reviewing the materials that you'll see online. So it's not it's more of a value add, and they're quite entertaining to listen to. So you might find that it helps supplement your information, and again provides an avenue to learn some of the material in a way that might be a little bit more exciting for some of you than reading it in a textbook or watching it on a video.
Yeah, and I just saw that on the recorded webinars, I believe it was stated that if we failed one exam, we would just have to redo what we failed, and that's the way it was 2 years ago. But your college has decided that you have to pass both, or you have to rewrite both again. So that's just what we've been told.
Yeah, so and any questions about that setup can be kind of sent back to your college around questions with respect to why do we need to pass both or not. Mm-hmm. Basically, James and I are advisors, and we provide the information on the contact. We provide advice on the material and get you through it. The pass rate, the 60%, and the idea around what happens if you fail an exam, that we work specifically with your college, because they're obviously in charge of how you practice in Ontario.
Yeah. So there are some other things. If you have technical questions about the site and what plugins you need, you can click on the thing that says technical FAQs. This is where if you have problems with your videos, you need to put in these certain plugins for your website, for your browser. This gives you some ideas for how best to download the podcasts. It sometimes is tricky. Please feel free to email me directly and just let me know what you're struggling with. Don't go crazy. Just email me, because that's our job, is to try and help you get through this process. So, we've got stuff on the live webinars that we'll be posting. Here's how you get a free subscription to the podcast that we do. We're not presently using any sort of a discussion board yet. We may at some point, but it's available. But at present we're not using it. Okay, so I'm going to quickly go back to the keynote and go from there. So
while you're doing, sorry.
Go ahead.
I was just going to answer some questions while you're getting the
go ahead.
Set up. There was a question again about the live webinars and if will they be available in a recorded manner at a later date. And so that is our plan, to have all of those available on the tech website. This will be our first time recording it and seeing how we can upload it and space like that, but I do believe it's going to be possible.
Yeah.
So those will be there, because there's right now we have, for example, 39 people on the webinar, and we anticipate there'll be far more than 39 people that will want to hear this information. Now, having said that, this information should already be included in your videos, but for example, a really good distinction was the one James just made around what happens if you fail one of the exams and not the other. The recordings say that you could just do the other one when you do the exam, and that has been a change that's been made by the college in Ontario. So the webinars will give you the most up-to-date information, and also it'll give you a chance to interact with us directly in a way that hopefully is efficient.
Yeah, and we recorded those 2 years ago.
Right.
And so there's been some updated information that we will hopefully bring to your attention when we do the particular topics. And the topics these are not the topics that we're necessarily going to do all of the, this may be some of the topics that we'll do for the webinars, but these are the typical topics that, and we would sort of suggest you kind of do them in this order if that's of any value, but we've already talked about the order, starting off with the evidence-based prescribing information and that sort of stuff, and then getting into cardiovascular and so on. So like we said, the assessment process is still under development, and the process, we've been using it for almost about 3 years, and so I think we've got it pretty down, fairly good process now, and it's what we've used in BC, is what we've used in Alberta, and we've tried to let you know about what happens for those of you who are not successful. You will hear specifically about why, especially with the oral exam, we'll let you know specifically if you did fail, why you failed, and so on. This is just we've already just briefly talked about this, in that the written exam will be 100 multiple choice questions. It's open book, and it just lists the sort of information that you need to know. This is approximately 50 of the questions come from your readings and therapeutic choices. Roughly 40 come from the recorded live sessions. So it's sort of a balance between what you're going to read in therapeutic choices and what you're going to hear about on the website. There are some pharmacology ones. They're fairly basic pharmacology ones. So if you've not gone back through the pharmacology textbook, I don't think you need to worry about that. They're fairly basic pharmacology questions that you should be able to answer. And then once we understand exactly what specifically you're able to use, what sort of substances, there'll be some jurisprudence questions that we will be asking you to do. And then there's also so there's that part of the sort of multiple choice written exam, and then you'll be given some prescription sample questions, and you'll be asked to identify what is the particular thing missing from this prescription. And we'll talk about that, and we actually have a webinar, not a webinar, but a recording all about how to do that. So this is just, again, more information that we really already talked about. The open book, the oral exam is an open book preparation, 75 minutes. Prep time, 3 cases, 25 minutes per station. Once you're letting the evaluator, when you're in front of the evaluator, it is no longer an open book. You're able to bring in your sheets of paper and stuff, but you can't be madly looking up when they ask you questions about the cases. And it's very structured. It's a very structured process. You're asked to identify the goals of therapy for each case, the therapeutic options, list the advantages and disadvantages, provide the rationale for why you did certain things, identify what you're going to monitor, and then at the end you'll be asked, what are other things that you want to do? And all of these things you get marks for, and we'd encourage you to make sure you think about advantages, disadvantages for every option, what monitoring parameters. And you can come in with a one-page sheet that basically has, and if I was to do this, I would be creating one-page sheets for pneumonia, one-page sheets for hypertension, one-page sheets for peptic ulcer disease that lists, the 4 or 5 therapeutic options and the advantages and disadvantages of them. And I would use that as your material. Anything you want to add to that, Adil?
No, I think we're going to go over this material or these kind of how to prepare for the cases in a fair bit of depth. I like that the core of every case will include things like your 5 goals of therapy, listing 5 treatment options, and for each treatment option listing at least 2 advantages and disadvantages for each of the options, and then selecting one of your treatment options, and then deciding what to monitor for, and who's going to do the monitoring, and when are they going to do the monitoring, and considering things to monitor for safety and for efficacy as well. And also then talking about all the other things that you want to do with the case. One of the questions that came up, which relate directly to the case, was, in a case, will there be multiple medical conditions that we're addressing? So each case will have one theme medical condition. For example, it might be hypertension, but that patient with hypertension may also have gout and may also have obsessive compulsive disorder. But you will see at the top that we are dealing with hypertension, and your job with respect to goals of therapy and therapeutic options and treatment parameters will be about addressing that person's hypertension. We know that patients come in with various comorbid conditions, so we're trying to be reflective of the type of patients you may see. And also, when you notice they're on multiple diseases, they might be on multiple drugs, which leads to concerns around drug interactions. So you might see some of that flavor. But when it comes to, do you have to fix all of their problems? The answer is no. You really just have to address their main problems, not create any new problems by addressing their current problems. And you will have time at the end of each case to talk about any additional things that you want to do, and that may help address some of the other issues, but those are ancillary and very few points, if any, attributed to that kind of work. So we're really focusing on one disease state per case as you go through.
I just thought I'd put up this is one naturopathics review of the course, and I think the very first line is exactly what we think probably most of you thought about in regards to the course that you're about to undertake. We realize this is just one ND's review of the course, but in general, we've been really, really pleased with the reception that we've gotten, and I think a lot of it comes from we are not pro drugs, we're not anti drugs, we are pro using things that will actually help your patients get better, and so even if you had a quarter of the benefit of what this person is saying in regards to the with regard to the course, that we would love that. And so our goal is to really allow you to learn a whole bunch of material that will actually really, really help you practice. Even if you could never prescribe anything, it will really, really help your practice, and it'll really the bottom line is knowledge is power, and we're all about being knowledge brokers for our patients. And I won't even bother putting that rest of it, but it was just really a very useful process for this individual, and I think a lot of people, it really, really helped them in their career. So I think we'll leave it at that for now. unless there's anything else, we like to try and keep on time. And Adil, I can hear in the background, has been typing like mad and has been answering lots of questions. So I appreciate you doing that, Adil.
No problem. And one of the gentlemen, or I think it's a gentleman, was saying you might be cutting out as you're speaking. So hopefully we got the information that you need across. There are a few questions I also do want to make sure we get answered. If we are cutting out, please just let us know. Sometimes my typing or sounds on my end might override James's, so hopefully we can look at muting a bit better as we go forward. And it seems like technologically, or the technical parts of this webinar seem to work for most of you. I didn't see a lot of, hey, wait a second, we can't hear, or this, we can't see. If there were any of those problems, please let us know, assuming you can hear me now. A couple questions about RX Files were raised. So RX Files is a Saskatchewan organization. They deal with academic detailing. Essentially, that's their main bread and butter. And academic detailing is just like a drug rep or a sales rep for someone who sells herbal drugs, if you will, or homeopathic drugs. And they come to your office and they try to detail you on all the information that you need to know about what they're trying to sell. In academic detailing, we have people who aren't attached to any particular company. They essentially work for an organization, a healthcare organization or a Ministry of Health, and they provide unbiased, hopefully unbiased, information around how do you treat a disease state. So RX Files is a compilation of information that is very quick and easy to access. They usually try to put that information on one or two pieces of paper, so the font is microscopic. I mean, you do sometimes need to zoom in or get a microscope to read really well all the material.
I think you meant magnifying glass.
Yeah, what did I say? A microscope?
Yeah, but that's okay.
Yeah, well, you could get a microscope. I was trying to be exaggerative in this. Is that a word? But
No,
a magnifying glass would help too. A telescope, even. Anyway. So RX Files is just one of these ancillary kind of tools that other NDs in the course have said is useful. I think for about $80 you can get a textbook shipped to you, and for I think a little bit more than that you can sign up online to get access to all their material via PDF. And so that is that's not an area that we're saying you have to have, but people have use those. They brought them into the exam to help them find some specific information quickly, and so that answers questions around RX Files.
And there was one question here about, can you give an example of creating a therapeutic plan where it says, 5 to 6 specific parameters. And so the bottom line is anytime you're going to start any medication or really any therapy is, you should be able to come up with 3 or 4 key benefits. So, I don't know, let's say it's asthma. So you should be able to say, well, the patient will require less salbutamol, less as an inhaler. They have less. What's the word I'm looking for? I'm losing my memory here.
Less rescue.
Less rescue medicine, less exacerbations. Having to go to an emergency room. Their quality of life is better, and so on. And then for toxicity, you'd be monitoring the specific toxicities of the therapies. So if it was an inhaled corticosteroids, you'd be letting the patient know that in general, inhaled corticosteroids have very little systemic side effects, although in really big doses you may get some. But you can get thrush, you can get voice changes, and so on and so forth. So those are the specific parameters that we'd be looking for in a therapeutic plan.
Okay, a couple questions about the exam and the sittings. So we understand there's over 1,000 NDs in Ontario, and so there will need to be multiple sittings to get most of the NDs through. So between now and 2016 and 2017, I think there will be exam sittings. I think there is more of a pressure on some people that already have IV use in their practice, and those people may need to get through the exams earlier. And so as far as I know, the college will send you guys an email with exam dates, and you guys will sign up with them for exam dates. There's a fee associated with the exam that you guys will pay directly to the college. And so anything that has anything to do with those kind of logistics of the exam, that's something to connect with the college for. We will run the exams once we know what the date is, and we will obviously be the ones to come to with respect to what kinds of questions are on the exams and how do I help prepare for the exams. That's all us. But anything around the logistics of the exams is going to be addressed by the college. And Erica specifically is probably the person to connect with, or at least the person we've been connecting with.
Yeah, and one of the things that we are limited by is that we can't functionally run exams for 10 or 15 people. For us to even come close to being able to run these exams, we have to probably have a minimum of maybe 50 or 60 people. So there's a whole bunch of logistics, and we're hoping that the college sets these up. We also do appreciate that they're struggling from the concept of exactly the what the regulations are going to be, and so it's a process that seems to be changing on a fairly regular basis. But I do know they're working hard to try and get everyone, give enough information to you guys so that you can actually make an informed decision.
Yeah, and I agree. And there's a question around just the timelines. If you've just signed up for the exam now, or for the online course now, trying to prepare for the January exam, that is a lot to do, especially given that there's a Christmas holiday between now and the January exam. So I do believe you will be able to sign up for exams in February. And I see there's a deadline of May for some folks who are faculty at the CCNM. And so it is my understanding that we will try to have at least 2 sittings between now and May. And so we'll try to get those, especially those that are pressured from a priority point of view, in through the exams. So we will try to make those available as best we can. So we are going to work with your college a fair bit, and to the best degree you guys connect with the college about your needs for the exams. We encourage you to do that as well.
Yeah. But the actual time of the exams is literally out of our hands.
Right. Right, exactly. And a question about the oral exam and notes. So we talked about the exams being open book. The written exam is entirely open book, with the exception of any kind of electronic tools. So you won't be able to bring in your iPad or your tablet or your smartphone. You will be able to use any kind of written notes that you've created, RX files, the textbooks, any of that. The exam, I don't know if you're thinking 2.5 hours is a long time or not a long time, but the experience we've had from all the other people writing is you are pressed for time. People sometimes leave questions unanswered, and the number one reason that is because they're spending a lot of time looking up questions. Anticipate that you can look up about 20, 25 questions on the exam, but you will need to know going into that exam at least 70 questions, or hopefully the answers to about 70 questions. Having said that, you only need to get 66 questions out of 110 correct to pass the exam. We do not publish your score to the college. We just tell them whether you passed or not. With the exception of if you got less than 66, we do give them a sense of how close you are to the margin of passing in case they want to consider that. For the oral exam, you will have 75 minutes of prep time, upon which you can use your textbooks and any material that you want. But when it comes to going into the exam with the oral assessors, you will just be able to take the case in. So each individual case, you'll have 3 of them during the prep time. And you'll be able to take 1 additional piece of paper that you're able to take notes on. So the oral exam in front of the assessors is not technically open book. You already had 75 minutes of prep time for all 3 cases prior to going into those oral exams, at which point you prepared your material about what you want to say. And more to come on the oral exams as we go through this webinar, and you'll see them online.
And I also noticed there's a few nice comments about the fact that you guys are going through some of this material and you're finding it, I think, interesting, and you some of you who have actually listened to the podcast ahead of time, so we really appreciate that feedback. And like I said, our goal is to really just make you a lot smarter, not that you're not smart now, but a lot smarter when it comes to prescription medication, if you will, and realizing that just because something is non-prescription doesn't mean it's not helpful or not toxic. For instance, things like ranitidine and acetaminophen and all sorts of things are non-prescription, and those are equally beneficial and sometimes equally harmful. So it's all about using the proper therapy.
There's only two more questions. Maybe we can do these
Go
two
ahead,
and
yeah.
then wrap up.
Yeah.
One is just a suggestion around webinars, and when they watch I think they mean the online tool, and they want to refer to the PDF slides and documents at the same time, and they're having a hard time kind of seeing both on the same screen. So there's a suggestion around how can we make that better for them.
Well,
I know for me,
so I was going to say, you should just be able to download the PDFs.
yeah, you should be able to download them and print them, but I think people are having a hard time going back and forth on the same screen to see the slides or watch the video and the PDF. You could probably hear the sound of the video and use the PDFs, or if you've got like an iPad and a computer or a dual screen, you should be able to look at the two. Yeah. But that is a good suggestion that we will take into consideration. There's something about specific information on how to create a therapeutic plan in any of the recorded webinars. So yes, the webinars, if you go through them, I know I did it in the diabetes or the online diabetes case, and I did it in the depression case, where we walk through kind of creating the goals of therapy and creating a therapeutic plan with coming up with advantages and disadvantages of therapies and what to monitor. And if these webinars will be also doing that, so you'll get a lot of chance to practice that as well. And then last question just came in the oral exam, the one piece of paper we write notes on and bring in with us can be prepared ahead of time, or does that need to be written during the prep time? So essentially, I think that's asking, can you prepare for an example case of, let's say, depression and have a prepared template with information pre-populated? The answer to that is yes, you can. Just make sure you tailor some of that information to the actual case. And some people have created those templates. So I think we've exhausted those questions and our time today. Feel free to email us. Sounds like James wants to get a word in there.
No, I was just going to say that, and we'll just let the next podcast, but go ahead, just finish off it, and then we'll just let you know about the next podcast.
Yeah, I was going to say, feel free to connect with us outside of this on the tech website. There is a way to send us some feedback or ask any questions that you have. That's probably a good way to do it. We'll kind of keep interacting, and hopefully we'll be able to guide you through that. Feel free to send your feedback. This is going great, or it's not going great, and we will. We like to hear all those things and keep connected to you as best we can. There is one last statement I'll make. There is a group of NDs. I can't recall their organization, but they are looking at potentially bringing us over for a live course sometime in the early 2015. So you can keep your ears peeled for that. If you are kind of wanting to do the live course, you do not need to participate in the live course to do well on the exam. Even in BC, where James and I live, we offer the course online to the BC students, and they have had a similar pass rate, or sometimes even better. Now, sometimes it helps that they are students and they're in that mode, but they've not seen us live and they do well, so you do not need to have us there live. But some people do learn better live, and certainly James and I are, I think, more entertaining to listen to live because we look funny.
So speak for yourself.
Yeah, it's the BRBCE group. Thank you for letting me know the name there.
And they're trying and. If they get and we get enough interest in doing that, we would love to come out and do a course, but we will probably need a fair number of people interested in that course, and it would be great if you're interested to let them know, and if you really are keen on having it done, if you could let other people know about it, that would be great, because we're going to probably need at least 100, maybe 150 to do it, and so just let them know. So the next webinar is 2 weeks from today, and we're going to go over some basic principles for prescribing. And we may touch a little bit on some evidence stuff, but we're going to go over some sort of basic principles of how we think you should prescribe. And a lot of it will be very much related to what you do on a day-to-day basis, even today. So we look forward to chatting with you. We love the fact that you guys interacted with us. And if you can, let people know about it. If it's good. If you don't... If you didn't like it, then we'll go ahead and let people know too.
Thank you, everyone, for attending today's webinar, and we look forward to chatting with you again in a couple of weeks.